2018 online interviews. Today we're going to find out more about why therapists don't get referrals from the medical profession and 3 things you can do about it. Dr. Toh Wong, who is speaking to us at the convention this October, is going to speak to us more about this topic. The Integrative Health Convention is an annual convention in London, featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through their various healing practices. It's an opportunity for doctors and therapists to meet, share, learn from, and connect with each other. We believe that true health is holistic and that people get better in more than just one way. And that we all have so much to learn from each other. And the Integrative Health Convention provides a stage for this for therapists, doctors, and for the public. There are limited tickets which can be purchased at integrativehealthconvention.co.uk. This series of online interviews will help you to get to know our speakers who are leaders in the different fields of healing or therapy or medicine, and maybe help you decide which talk you want to attend out of the 36 to choose from over the 2 days at the Integrative Health Convention 2018. I'm your host, Dr. Naveed Akhtar. I've been a GP for over 9 years in Essex, and I'm the co-founder of Neurolinguistic Healthcare Limited, the co-organiser of the Integrative Health Convention 2018. Neurolinguistic Healthcare provides courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis for healthcare providers at neurolinguistichealthcare.co.uk. Today, I'm speaking to my business partner and the other half of Neurolinguistic Healthcare Limited, who will also be speaking at the 2018 Integrative Health Convention at the Park Plaza in Victoria, in London, to share with you what they know and to tell us a little bit more about who they are and what they do and what to expect from their talk at the convention. This is Dr. Toh Wong, who is a co-founder of Neurolinguistic Healthcare. He's a GP trainer, a clinical hypnotherapist, and the co-organizer of the Integrative Health Convention 2018. So, Dr. Wong, should we begin by letting our audience know a little bit more about yourself that I haven't already covered?
Hi, Naveed. Strange to be on this side of the interview. So, like many of us, we sort of stumbled into medicine because some of us maybe wanted to help people. For me, maybe not so much. Maybe it was that it was the next challenge. But over time, since I've been a doctor, over the years and been in medical school, and it's really become a passion of mine to actually want to help people, to make people better. And so over the years, after getting an honors degree in medical school, and for almost every year after I graduated, doing an extra postgraduate qualification, you start to think, well, what else can I do? What else can I do? What else can I do? And one of the things that I did was attended some acupuncture training with the British Medical Acupuncture Society, which is really just an introduction to acupuncture. But then what that did was, I didn't believe in it myself. But I did it anyway. And what I did was started practicing it on patients. And then suddenly, people who've had problems, had pain for weeks, months, years, who we've been treating with standard treatments, got better. And some of them got better instantly, just like that. It just blew my mind that there was something out there which we didn't know about, that the medical profession was unaware of, that there are other modalities that make people better. And from there, I started to look into what other things that we didn't know about. And the thing about medicine and the thing about being doctors, one of the fortunate things we have is that we believe that we can learn anything. maybe it's an exaggeration, but I looked at things which I didn't know anything about. Things like hypnosis. One of the things then what piqued my interest was Richard Bandler and NLP. And then I looked into training with him and online, and various other trainings. And that's when I discovered neurolinguistic programming. And I've read numerous books at that time. And then we looked into some courses in NLP. And that's when I met Dr. Akhtar and Naveed here. And that's when we met doing a master practitioner training. And then we realized that Naveed and I Naveed had also independently in his own time collected lots of training, lots of data, and lots of case studies. In fact, although younger than me, he'd done so much more than I had. And he really got me into hypnosis, which I believe forms a lot of the basis of what we chose to learn in NLP for therapy. And so he got me to go on some training, and he taught me what he knew, and he shared all his content. And together we've watched and learned and heard and listened and read thousands and thousands of hours of training. And what's more is we started to talk to each other, and we started to apply the training and modify it to make our own therapeutic techniques and our own communication skills that we can boil down to just a few basic, easy to learn principles. And we said, we've got to share this. We've got to go out and share it with everyone else. And so that's when we started neurolinguistic healthcare. And then the next step was there's lots more knowledge out there which we didn't know anything about. And we thought, who best to learn all this from? And because we know therapists, we've met therapists, and they've said, and they tend to be interested in other sorts of complementary therapy. So we said, well, why can't doctors find out about complementary therapy? Where can they find out about complementary therapy? Where can complementary therapists find out about other sorts of complementary therapy? And that's when we said, there isn't a place to do that we can find anyway, that's affordable, because there are integrative health conventions, but really full of research and funded by pharma, and really expensive venues, very expensive, non-accessible courses and conventions. And so we said, why don't we set some up? We set one up. We'll set up an integrative health convention where we can get doctors and get therapists and share what they know, but not just any therapists, not just any doctors. We'd like therapists with years and years of experience, people who are into sharing and who are not afraid of sharing what they know with other people. And so we're so lucky to have organized this convention, and we have an amazing group of speakers wanting to come and speak to us. And that's really our story, really my story. And I'm sure we'll hear about your story at some point, Naveed.
It's been a very interesting journey with you, Toh, and setting up this convention and bringing experts from all around the country, experts in their fields. And I think the convention is going to be an absolutely incredible 2-day event. You're a doctor, you're a trainer, but your alternative fields include acupuncture, hypnotherapy, neurolinguistic programming. Tell me a little bit more about your experience with some of these other integrative fields and how they kind of merge in your daily medical practice.
So I've told you, and I'll tell the public now, what I do, and I'm sure my patients are familiar with it, is that I integrate acupuncture in my day-to-day 10-minute appointments in general practice. And so every day I do at least 3 or 4 cases of acupuncture for conditions that I know will get better very, very quickly in very short acupuncture sessions. I'm not saying I'm an expert, which is why I'm not speaking at the convention, but I've done acupuncture for over 10 years now with very good results. And we've got an amazing lady coming to speak about acupuncture at the convention, Amanda Shale, who I rate very highly, and I'm going to one of her acupuncture trainings in Vancouver this June. I'm sure I'll learn a lot from it there. And it's about learning, isn't it? It's all about us going forward, learning more, wanting to be better, being better at what we do so that we can help more people. And then with the NLP, it's really great because you can integrate that in your speech, in your consultation. making people better. So the other things I do is I train registrars. I am a clinical supervisor for foundation doctors, and I've been doing that for about 8 years now, being a GP trainer for 6 years, if not more. And the other thing I do is we train medical students, and I've been working with medical students for the last 10 years. And I have a special study unit in acupuncture, which we run every year at our practice for the last 5 years or so. And students really enjoy it. And they're completely amazed by what we do. And sometimes I get hypnosis patients in. And hypnosis, I can tell you, what it's done for patients is it's made people with problems which medical profession has given up on change the way they look at things and improve. In fact, one of the things that I've treated is irritable bowel syndrome. And did you know that the NICE approves hypnosis for irritable bowel syndrome? Probably the only hypnotherapy that's recommended by NICE, but it does work. And when someone else has no other avenue, and always I am a doctor first, and I do believe in what we do. I do believe in what we do, and I do believe that the diagnostic criteria do fit in our model, like it fits in all the other complementary therapist model. We have to make a diagnosis so that we know the correct treatment. But sometimes the treatments are limited. Sometimes you got to look out of the box. So that's what we're all about, looking out of the box. So that's what I do. I incorporate NLP with therapeutic language, hypnosis using the language, not necessarily hypnotizing people, but using the principles of hypnosis, which in the convention you and I will share with the delegates. And I use acupuncture every day. And that's what I do. And I don't know if I know you know this, but as a full-time GP, most full-time GPs work what we call 8 sessions, sometimes 9 sessions, which are half days. And we see over 100 patients a week. In fact, we see about 30 patients a day. So 30 times 4, that's 120 patients. And most...
At a minimum.
As a minimum. I had a friend in Birmingham, and he saw 70 patients a day. Now, that's an extreme spectrum, but it's not unusual to have 70 patient contacts, including telephone consultations. Every member of the public is registered with the GP. So I really feel that GPs are the ideal people to know about integrative health, so that maybe we have an avenue to let people who know what they're doing, spend more time with patients, because we only have 10 minutes as a consultation time. 10 minutes, unfortunately.
It's very limited time.
Very limited time. I mean, we've designed tricks and techniques that we have to teach people to use in 10 minutes, and that's why our specialty is, isn't it, Naveed? What we do is we design 10-minute consultations to get the most out of those 10-minute consultations.
Absolutely right, Toh. So at the convention this October, we're hosting this integrative health convention at the Park Plaza in Victoria. You'll be speaking and I'll be speaking, and the talk that you'll be presenting is why therapists don't get referrals from the medical profession and 3 things that you can do about it. Can you tell us a little bit more about what you're going to talk about and what the audience is going to hopefully gain out of this?
Now, this talk came from a friend of mine, met this therapist, and we were sitting in a pub one day, and he says to me, I can't stand another day in my day job. All I want to do is I want to do hypnosis. I want to do hypnotherapy. I want to help people. That's what I want to do. Don't want to sit in my 9-to-5 job in my cubicle doing what I do now. I want to do my passion. And this guy, he's amazing. He's gone for training. He's gone to improve himself, gone to learn different techniques, extremely good at what he does, completely undervalued by the system. And I said, no, we need to do something about this. We need to design a program so that you can get known, so that we can help you get more referrals. Because I can tell you what doctors do. I know you and I know what we do with with these cards and marketing materials that come through from osteopaths, chiropractors, physiotherapists. Those are the usual ones that we get, and sometimes hypnotherapists, and then some other sorts of therapists. But they go straight in the bin, because this is, it just amounts to waste. There's loads and loads of junk mail we get, let alone from the drug companies. And so it goes straight in the bin. And so we've designed, so that's how it's come about, this training. And I've designed a step-by-step approach as to what we can do about it. And I'll share what I know with the delegates, because I think it'll be really useful to have an inside viewpoint on how we think as GPs, what's going on in our lives. 100 patients a week, at least 50 results a day, if not another 50 letters that we have to read every day during this time, and home visits, especially when I work in Devon and the elderly population is quite high. People over 85 take a lot of our time, really need us. And so we're so busy, but there is a way through the front door. Maybe it's through the back door. But we'll share that with you during my talk. Okay.
I want to ask you one particular question. As a therapist, as a teacher with many years of experience under your belt, what do you think in particular is the key to healing in what you do?
The key to healing, you say? Now, one of our wonderful talks with Ian Watson is that he says, there's a difference between healing and curing. That's such a profound answer. I'll give you the doctor's answer. I'll give you the evidence base behind what I think is the key to therapy. And there is a lot of evidence out there about the therapeutic relationship. And I believe all therapies, all healing boils down to the therapist-patient relationship, and about connecting, about and sure, we don't get it right every day, but when we do get it right, when it does happen, when that click and that connection occurs, when you listen intently enough, that after a bit of time, you both connect on a deeper level, and that's when the healing occurs. Both of you get each other. And I think there's enough evidence out there to say that there is a lot about this therapeutic relationship. The question is, how does it occur? And what is it? On our courses, we've got an idea what it may be, and we will introduce that to you. And that's what we have in our neurolinguistic healthcare courses. Our more advanced courses will talk about techniques to improve this connection, this communication, this therapeutic relationship. Sure, there's lots of evidence out there on how to do it, what to do it, what works, but more importantly, what doesn't work. And so that's what I believe we can share with you, and that's what I think is the key to healing. Connecting and that relationship.
That's really fantastic. Well, thank you all for taking the time to watch and listen to this interview. After choosing this one of all the other interviews out there, remember to get your tickets early now from our website by following the links below. We are at the Integrative Health Convention in London on the 13th and the 14th of October 2018. You can use the discount code podcast10, which will give you a 10% discount as a gift from us to you for sharing your time with us. When we see you in October in London, our speakers will be sharing so much more with you then. We hope to see you there. Bye for now.